Good morning, students. This is Sneha Smriti Guha. I will take class on the topic of Bell's palsy. You all know about the Bell's palsy means it is a one type of facial paralysis when the patient is having any deformity which will be related to neurological disorder. In that time, the patient is having the problem of this Bell's palsy. Then Bell's palsy, it is an idiopathic facial nerve palsy due to unilateral inflammation of the seventh cranial nerve, which results in weakness or paralysis of the facial muscles. It means it is idiopathic, means the real cause which will be unknown. In this, the patient is having the problem of facial nerve palsy, and it will be occur because of unilateral inflammation when the seventh cranial nerve which will be weak. In that time the patient is having the problem of facial paralysis, or the muscles which will be weak. In that time the patient is not able to move their face. Then definition: Bell's palsy is a disorder of seventh cranial nerve or facial nerve which is characterized by unilateral paralysis of the facial muscle. Means it is a disorder, means it is seventh cranial nerve disorder, and it is characterized by unilateral, means the patient is having one side facial muscle paralysis, that facial muscle which will be not able to work properly. Or the another definition, that is Bell's palsy is an acute peripheral facial paralysis of the infratemporal portion of the seventh cranial nerve unilaterally. When the person is having acute peripheral facial paralysis, when the peripheral area of the face which will be paralyzed, or the infratemporal portion of the seventh cranial nerve which will be damaged unilaterally. In that time the patient which will be having the problem of Bell's palsy. Then what are the incidence rate of this Bell's palsy? The incidence is 13 to 34 cases out of 1 lakh. Means in 1 lakh persons, the cases of Bell's palsy which will be 13 to 34 cases. Then next, what are the etiological factor? Etiological factor, that will be age, then sex, then intracranial lesions. Intracranial lesions, when the person is having the problem of any infection in the cranial lesion, or if the patient is having any brain tumor or any tumor which will be present in the cranial nerves, or if the patient is having any trauma or the thrombus which will be developed in the cranial lesion, and which will be affecting the function of the cranial lesion. That time the patient is having the problem of this Bell's palsy. The next one is the thrombus. When the patient is having the problem of development of thrombus or blood clot in the area of the cranial lesion, in that time also the cranial nerve which will be not able to do the proper functioning. In that time also the patient may be developing the chance of this Bell's palsy. The next is the meningitis. You all know about the meningitis. It is the inflammation of the meninges, which is the layer of the brain. In that time, when the patient is having the problem of infection in the meninges, which will be affecting the whole area, or the cranial nerves which will be damaged, and because of this the patient which will be having the problem of this Bell's palsy. The next etiological factor, that will be intratemporal causes. Intratemporal causes, it included tumors, both benign or malignant. Means when the patient is having any tumor which will be benign or malignant, in that case only the patient is having the problem of Bell's palsy, because in that case is the tumor or the extra tissue growth which will be affecting, or which will be compressing that nerve. So because of this, that nerve which will be damaged, in that time the patient is having the problem of Bell's palsy. The next, if the patient is having trauma in intratemporal area, in that time also it will be affecting the facial nerve, or that is seventh cranial nerve. Then next is the extracranial causes. In extracranial causes, trauma such as birth trauma, means during the time of birth, if the baby is having any trauma in the area of cranial nerve, or any facial injuries, or after paro, uh, parotidectomy. So in that time also the patient is having Bell's palsy. Then tumor of parotid gland, if the patient is having tumor of parotid gland, so in that time also it will be affecting the seventh cranial nerve and the patient which will be having the problem of Bell's palsy. Then other condition, that if the patient is having viral diseases means how it will be affecting the patient. When the patient is having any viral infection which will be affecting the patient's cranial nerve, in that time also the patient may be developing the chance of this uh, Bell's palsy. Then next is the autoimmune disorder. Autoimmune disorder, when the immune system which will be affected, in that time the nerves which will be not able to do the proper functioning, or any infection which will be developing the chance of the function of the, or the inadequate functioning of the nerves. Then next is the vasospasm. Vasospasm means when the vessels which will be spasm of blood vessels which will be not supplying the proper uh, blood to the blood vessels. In that time also, when the nerves which will be not getting the sufficient amount of blood, in that time also the nerves which will be not able to do their proper functioning, and because of this the patient is having the problem of Bell's palsy. Then next, pathophysiology of Bell's palsy due to any etiological factor. Any etiological factor, that means if the patient is having any infection or any autoimmune disorder or any injury into the cranial nerve or intratemporal injuries, then it will be causing ischemia. So because of this, the nerves which will be not getting the sufficient amount of blood or oxygen. So because of this, edema of the connective tissues. Ischemia which will be occurring, edema of the connective tissue. The connective tissue which will be edematous. So when the connective tissues which will be edematous, in that time it will be creating vasospasm. So because of vasospasm, means when the vessels which will be spasmodic, in that time the patient which will be leads to Bell's palsy. Then what are the clinical features which will be present in the patient who are having the problem of Bell's palsy? So first, the onset. Paralysis begins suddenly. In many cases, the paralysis occur at night during sleep. Means the onset which will be sudden. So in many cases, many patients which will become with a complaint or with the case of this paralysis, which will be mainly occur at night during the time of sleep. The next is pain. There may be pain behind the ear before and after the onset of paralysis. Means patient is complaining pain behind the ear before and after. Means paralysis के onset के पहले या बाद में the patient is complaining that the patient is having the pain behind the ear. Then the palsy. Forehead cannot be wrinkled on the affected side. Means in the Bell's palsy, the patient is having the problem of unilateral. Unilateral means one side which will be affected. So the forehead, it cannot be wrinkled on affected side. So affected side, उस साइड का जो forehead है, that will be not wrinkled. Eye on the affected side cannot be closed. When the patient is having Bell's palsy, in that time the patient is not able to close the eyes in affected area, affected side. There may be epiphoria due to impaired drainage of tears because of weakness of the lower eyelid, which sags down along with the lacrimal puncture. So the patient is also having the problem of epiphoria, which will be occur because of impaired drainage of tears because of weakness. Means the lower eyelid which will be weak, and because of this the sags down along with the lacrimal puncture. Then next clinical feature which will be present in the patient, that is angle of mouth deviated toward the normal side with dribbling of saliva from the angle of the mouth. Means the patient is having the problem of deviated mouth, the mouth which will be deviated towards the normal side में mouth which will be deviated with the dribbling, the saliva which will be dribbling, because the patient is not able to um, the patient is not able to swallow properly. So because of this, the patient is having the problem of dribbling of saliva from the angle of the mouth. Then taste may be lost. The patient is not having any taste on affected side, means that part which will be fully paralyzed. So in that case, the patient is lost the taste on affected side, then salivation may be reduced, and in affected side the salivation also reduced. Then next is the patient is having sudden pain associated with mild behind the ear. Patient is complaining that the patient is having sudden pain which will be associated behind the ear. Taste may be also affected. Then the patient is also having the problem of hyperacusis. Hyperacusis, that means a collapsed tolerance to usual environment sound. The patient is not able to tolerate the usual environmental sound. Then loss of voluntary movement of facial expression on the side of the Asian patient is not able to move, or the patient is not able to show their facial expression on the affected side. Then salivation and lacrimation are reduced on the side of the lesion. So these all are about the clinical manifestation. The next is the diagnostic evaluation. Diagnostic evaluation. So basically in diagnostic evaluation, first we have to take the history of the patient. In history, we have to ask about the symptoms, then what are the signs which will be present in the patient when the patient is having paralyzed attack, and what are the duration, what is the onset. Then after that we have to perform the neurological examination. In neurological examination, we have to perform the cranial nerve assessment. In cranial nerve assessment, when we will perform, or when we will see the seventh cranial nerve, in that time we will see that the patient is not showing any facial expression. The patient is not able to showing any facial expression, and the patient is not able to do the voluntary movement. Then next is the radiographic CT scan. We have to also uh, instruct the patient to perform this computerized tomographic test. And that time we will find out that the patient is having the problem of cranial nerve damage, means what are the cause of this cranial nerve, seventh cranial nerve damage. We will find out with the help of CT scan. The next is the VDRL test. VDRL test, that is venereal disease research laboratory test. It is a blood test for syphilis, as we have already discussed about the causes in that sorry, we have discussed about the infections. So we have to perform the blood test for syphilis that was developed by the lab. The VDRL is used to screen for syphilis, means we will find out that the patient is having any syphilis infection. It detects the antibody which is present in the bloodstream when the patient is patient has syphilis, means with the help of this VDRL test, we will detect the antibody, means the patient's body which will be present in antibody in the blood stream when the patient is having any syphilis infection. So we have to perform these tests, and with the help of this diagnostic finding, we have to find out the, or we have to confirm the diagnosis of the patient. Then next, the treatment. The first that will be treatment to minimize the denervation, means deprive of nerve cells. Means हमको first we have to deprive nerve cells. We have to decreases to the chances of damages of nerve cells. Then next we have to give the corticosteroid therapy. Why we have to give this corticosteroid therapy? Because the patient is having the problem of spasm means inflammation or edema which will be occurring in the patient who are having the problem of this cranial nerve inflammation. So we have to give this corticosteroid therapy. In corticosteroid therapy, we will give prednisolone. That will be 1 mg per kg of body weight. That action is anti-inflammatory action, and it will be reduces the edema. Then we have to give the vasodilator. In vasodilator therapy, we will give the histamine which will be helps to relieve the vasospasm. It will be releasing the vasospasm as we have studied in pathophysiology. The patient is having the problem of vasospasm, so we have to reduce the vasospasm. We have to give the vasodilator therapy for the patient. Then next is the general management. In general management, massage of the paralyzed facial muscle from down to above. We have to give the massage of the paralyzed facial muscle from down to above. Then next is we have to also provide the electronic stimulation. Electronic stimulation, it prevent fibrosis and contracture of paralyzed muscle. Means with the help of this electronic stimulation, we will be able to prevent the development of any fibrosis or any contracture of paralyzed muscles. The next management, that will be plastic surgery. So with the help of plastic surgery, we will improve the cosmetic appearance and closure of the eye is performed, because in this, when the patient is having the problem of facial or paralysis or Bell's palsy, in that time the patient is not able to close their eyes in affected area. So with the help of this plastic surgery, we will providing the closure of the eye is performed. There is no hope of recovery. Means when the patient is not able to recover because of age or because of any immune system defect, so in that time we have to provide the plastic surgery management for the patient. Then next is surgical rehabilitation. In surgical rehabilitation, muscle transplantation. In muscle transplantation, why we have to do this muscle transplantation? With the help of this muscle transplantation, it will be help to prevent the contracture and fibrosis of the muscle. Then tarsophoraphy. Tarsophoraphy, it is the joining of part or all of the upper and lower eyelid so as partially or completely close the eye, because the patient is not able to close their eye in affected area. So in that time, in with the help of this torsoraphy, in this it is a joining of part or all of the upper and lower eyelid so as partially or completely we will close the patient eye. Then temporary torsoraphies are used to help the corneal heal or to protect the cornea during a short period of exposure of disease. Means or we have to perform this temporary torsopharies that are used to help. Means when we have to heal the cornea, and that time also we will perform this temporary torsoraphies, or we will also use this rehabilitation or surgical rehabilitation to protect the cornea during a short period of exposure of diseases. Then what are the nursing management? So in nursing management, first we have to do the nursing assessment of the patient. We have to see the patient, we have to observe the patient, any abnormality which will be present in the patient, any defect which will be present in the patient. Then we have to do the neurological function. Means we have to assess the neurological function. Basically in neurological function, we have to assess the cranial nerve assessment. Then after that we have to assess the level of pain. Means on affected area the patient is having any pain, and if the patient is having the problem of pain behind the ear, so in that time we will assess how much pain which will be present in the patient. Then we have to also assess sleep disturbance. Why we have to assess the sleep disturbance? Because the patient which will be not able to close their eyes on affected side, so the patient is having the problem of sleep disturbances. Then we have to assess the nutritional status of the patient. We will assess the patient which will be taking proper diet or not, and we will see that the patient intake output which will be proper or not. Then after that we have to assess the anxiety level of the patient. So in this Bell's palsy, when the patient is not able to move their close their eyes, or the patient is not showing any expression, so in that time the patient which will be developing the chance of anxiety. So we have to assess the patient anxiety level. So when the patient is having the problem of anxiety, so we have to explain about the disease, and what are the means we have to provide the psychological support to the patient. And next, what nursing diagnosis we have to make for the patient who are having the problem of Bell's palsy. In that, first is the self-care deficit related to loss or impairment of motor and sensory function and decreased cognitive abilities. Means when the patient is having the problem of impairment of motor or sensory function. So because of this, the patient is not able to do their self-care. So because of this, the patient is having self-care deficit. So we have to provide the proper care for the patient. Then if the patient is not able to do the patient is not able to maintain their hygiene, the patient is not able to maintaining their eye care, ear care. So in that time we have to help the patient. Then next is imbalanced nutrition, less than body requirement related to decreased nutritional intake. Sometimes because of disease condition, the patient is having the problem of imbalanced nutrition. So first we have to assess the nutritional status of the patient. Then after that we have to provide the proper nutritious diet for the patient, and we have to explain about the what are the importance of nutritious diet in our disease condition. Then we have to also measure intake and output of the patient. Then anxiety related to fear and changes in appearance. So um, in this Bell's palsy, the patient is having the problem of changes in appearance. So sometimes the patient is showing their face in mirror, and because of this, the patient is having the problem of anxiety. So because of anxiety, the patient is having fear. So in that time, we have to explain about the disease, what are the what are the management, and how it will be treated. Then what surgical rehabilitation which will be used when the patient is having Bell's palsy. Then we have to also provide the psychological support to the patient, which will be helpful for the patient to relieve the anxiety. Then interrupted family process related to anticipatory grief, and the burdens imposed by the care of the person with the terminal illness. If the patient is having the problem of terminally ill, in that time the interrupted family process. So we have to give the educate. We have to instruct their family members to provide proper care to the patient, and do the anticipatory care for the patient. So we have to give many instructions then how we have to provide the proper care if the patient is having the problem of terminally ill. Then, what health education should be given to the patient if the patient is having the problem of Bell's palsy? So, first is explain the need for monitoring for changes in neurological status and for complication. We have to instruct the patient or their family members for monitoring any neurological changes, any neurological status changes, or for any complications. So, when the patient is having any neurological status changes in that time, or any further complication which will be developed in the patient, so mm, as soon as possible they have to inform to the doctor. Then identify changes in neurological status and sign and symptoms of complication that should be reported to the neurosurgeon or nurse. Then the patient's relative, that will be identify changes in neurological status or any sign and symptoms which will be seen in the patient. So in that time it will be reported to the neurosurgeon or nurse. Then the skin care of the patient should be given. We have to give the instruction to the patient, to the family member regarding the massage of the facial muscles so that it will be relieve the contracture, or it will be prevent from development of fibrosis. Then routine physical examination is given. Then next is relaxation exercise, maybe reduces the anxiety. We have to instruct the patient, or we have to instruct their family members about the relaxation exercises, which will be reduces the level of the anxiety. So these all are about the Bell's palsy. So in Bell's palsy, it is a facial paralysis. So when it will be developed, when the patient is having the problem of seventh cranial nerve damage. So these all are about Bell's palsy. So thank you. If anyone having any doubt, then they will be asked.